I interacted with her like I did with the other nurses. She seemed keen. She was fairly conscientious. She was quiet.
I would describe her as a person as being beige.
Today we are unraveling the Lucy Letby's case. United Kingdom's youngest serial killer. In recent years, the world has been shaken by the shocking revelations surrounding the case of Lucy Letby, a former nurse at the Countess of Chester Hospital in the United Kingdom. Today, we delve deeper into this troubling saga, examining the facts, the investigation, and the implications it has had on healthcare systems globally. Lucy Letby, a nurse once regarded as dedicated and compassionate, now finds herself at the center of one of the most perplexing cases in medical history. Born in 1990, Letby pursued her passion for nursing, eventually landing a position in the neonatal unit at the Countess of Chester Hospital. But unbeknownst to the families, a nurse named Lucy Letby stalked the ward after dark. She hid an icy contempt for human life behind her sweet smiles and caring demeanor. Over the course of a year, Nurse Letby secretly murdered at least half a dozen of those precious babies. It all starts in 2015 with the shocking deaths of 3 premature infants. Seemed nice and healthy one day, but found dead later. Everyone was shocked and suspicious. Doctors and nurses are also confused. How healthy newborn babies are dying for no reason. The doctors raised their voices to the hospital bosses, but they neglected them all, thinking this news will have a deep bad impact on their hospital. The hospital bosses said that it's the fault of doctors and nurses for not caring for babies properly. Over the next year, 7 more babies died, and no one found the reason behind it. But one day the chief doctor grew suspicious because Nurse Letby was on duty when every single one passed. The physicians kept begging the admin to call the police. But it seemed the top management at the hospital cared more about avoiding scandal than stopping the slaughter of innocents. In the summer of 2016, yet another healthy baby went limp as a ragdoll minutes after Letby left the incubator room. The timing finally convinced doctors foul play was afoot. The doctors reported it to the police. Still, this angelic-looking nurse seemed an unlikely serial killer. Police needed ironclad proof before such an arrest, so they turned to the hospital records for clues and uncovered the keystone to their case. Turns out 2 different premature twins had suffered sudden blood sugar crashes while under Nurse Letby's care, one in February and another the following October. When they tested their blood sugar, they found that those twins' insulin levels were too high. It is like someone injected hormones into the babies. There is no one who can do that except Nurse Lucy. Because when those twins died, Nurse Lucy was on duty. Then a few days later she killed even more babies with the overfeeding of milk. These babies suffered from a deep pain. This shows that Lucy Letby was a ruthless killer preying on newborn babies. The parents found that their babies were healthy one day, gone the next. They were so sad because their babies are dying for no reason. In 2018, authorities launched an investigation into a series of suspicious deaths in the neonatal unit at the Countess of Chester Hospital. The investigation sent shockwaves through the medical community and sparked widespread concern among parents whose children had been treated at the facility. As the investigation unfolded, Lucy Letby was arrested and questioned in connection with the deaths of several infants under her care. The allegations against her sent shockwaves through the medical community and prompted soul-searching about the safeguards in place to protect vulnerable patients. While questioning Lucy Letby, they found that this killing started in 2015, when she injects air to a baby. This air is stuck in the baby's heart and stops the blood flow. This is pure cruelty. Then some days later she found another victim. She yanked away the oxygen pipe of a young baby. He struggled to breathe. Within a month, she killed nearly half a dozen babies with the injection of air. Over the next year, 10 more babies died, but Lucy Letby showed herself innocent. But at long last, justice caught up when police discovered the insulin evidence that unraveled Letby's web. When the jury returned, they found Lucy Letby guilty and sentenced her to 14 years behind bars.
You have no remorse. There are no mitigating factors. In their totality, the offences of murder and attempted murder were of exceptionally high seriousness, and just punishment, according to law, requires a whole life order.
Lucy Letby, the youngest serial killer in British history, will rot forever in the bowels of the prison system, paying an everlasting price for snuffing out the lives of her young victims. Yet even as she received judgment for her loathsome crimes, behind that angelic mask, Lucy Letby remained ice-cold and unrepentant, leaving the broken families without the solace of remorse or the comfort of clear motive. The Lucy Letby case underscores the importance of robust oversight and accountability measures within healthcare systems. It serves as a wake-up call for institutions to prioritize patient safety above all else. Thank you for joining me on this unsettling journey into the heart of the Lucy Letby's case. If you found this exploration intriguing, don't forget to like, subscribe, and hit that notification bell for more true crime content.